We are going to interrupt regularly scheduled program right now as we bring you some breaking news out of Huntsville. Top health officials right now giving us an update on the COVID-19 spread, mitigation efforts happening in our community. A lot happening here, a lot to unpack, so let's listen in now.
52 cases in Madison County, having resulted in 610 deaths in Madison County. Current positivity rate for Madison County is 16.4%. At this point, we'll go to our first speaker, Dr. Pam Hudson from Crestwood Medical Center.
Thank you, Jeff. It is a privilege to represent our hospitals and healthcare providers in giving you this hospital update. Today, our hospitalized numbers in the Madison County area, 181 inpatients, 48 of those are in the intensive care unit, and of those, 39 are on ventilators. 85 to 90% of the patients in the hospital are unvaccinated. 40 to 50% of our ICU capacity is taken up by caring for COVID patients. And I think that it is safe to say that while these numbers are a little bit improved over prior weeks, our healthcare system is still at a huge stress point. In the past weeks nearly overwhelmed the resources that we have to take care of our communities. I think my message today is that we're not quite out of the woods yet. We'd like to see several more days and a week or two of some downward trend. But something in the news this morning caught my eye, and it said in Alabama there is a surplus of ICU beds for the first time in quite a while. Surplus is not the word I would use for that. When you look at the state data, of the 200 ICU beds in the state, 196 of them are filled. That is not a surplus by any stretch of the imagination when we're talking about intensive care. If we have, as we do now in our county, we have no extra ICU beds, where exactly do we put the next critically ill or injured patient who comes to the hospital? So it is not, we don't have a surplus of ICU beds available, and again, we're not out of the woods. Unfortunately, some of the decline in our numbers are related to deaths. We have had over 30, right at 30, I think, in our community over the last 7 days or so. That is one way to have a hospital number decline, and we certainly don't ever want to see that. Of those deaths, 90% are unvaccinated, and as Jeff mentioned, our positivity rate at the hospitals are in line with what we're seeing and is being reported in the teens. Based on the CDC and state data, the vaccine works to prevent serious illness, hospitalization, and death. In Madison County, our vaccination rate for fully vaccinated is 59%, and while that is significantly higher than the surrounding counties, it's still not high enough. I think that when the CDC releases information that says that unvaccinated folks have a 10-time risk of serious illness, hospitalization, and death, that is something that we should be looking towards to point us to as close as we can get to 85 or 90% fully vaccinated. Jackson County is at 46%, Limestone at 36%, Morgan County at 42%, and Marshall County at 44%. So again, I'd like to encourage everybody who is unvaccinated and eligible to get in line for that vaccine. Monoclonal antibody use, you've heard a lot about that, and the press has done a great job of discussing that. Monoclonal antibody treatment is not a substitute for vaccination. And because of the surge here and the surges around the country, the monoclonal antibodies are now on allocation, and so is increasingly not a strategy for unvaccinated folks to count on. But no doubt the monoclonal antibodies have helped to reduce and prevent the serious disease and hospitalization. I have to remind you that masks work. There are multiple studies that support this. So whether you're vaccinated or unvaccinated, mask. And as usual, if you can be outdoors, that is the safest place for you to be and to do any kind of gathering. And especially when the percent positives in whichever area you're visiting are in excess of 15 to 16%, That is a community that has a high transmission rate, and so masking is really critical there. So again, please get vaccinated, and I'm thankful for those who have gotten vaccinated. The more people that are vaccinated, the less chance we have for the coronavirus to set up shop over and over again in vulnerable people and practice its good work of good viral work of mutating, and then those mutations being passed on to others who are unvaccinated and basically getting a foothold like we saw with the Delta variant. There's lots of vaccine policy activity going on, and I do expect it to continue. And whatever recommendations come out, we can expect adjustments. That is very confusing, as the media does a great job of picking up on new pieces of information and presenting them to the public. It is very confusing, though, from the standpoint of what is the ultimate recommendation going to be. When you are getting the front line of particular articles that are being written, sometimes not in peer-reviewed journals, they may make a fantastic headline and we begin to, and may even be true, but remember that we're following the science. We are trying to take care of patients. We're trying to follow recommendations made by scientists who look at the science and come to a consensus opinion about what's best for all of us. So, and again, in following the science, what we do know is the third dose of the Pfizer and Moderna are indicated for those who have had their original series and who are especially vulnerable, immune compromised, and may not have been expected to mount the kind of immune response that a healthy individual would. So those are approved now under an EUA, and more to come on exactly what the recommendation is going to be on the booster. So don't be surprised when the reports change. That doesn't mean the science has changed. It just means that the final determinations are being set forth. We hope to have a vaccine for pediatrics, pediatric age kids in the winter. And also remember that the flu is coming, probably already here. We just don't know it yet. And the two good things with the flu shot, the masks work really great, and also we have a good vaccine that is available now. I'd like to just take a minute to thank the healthcare workers and other essential workers who spend all of their work days helping other people. Please thank them by getting vaccinated if you're in an eligible population. And many of you have vaccinated during this current surge, and on behalf of all those healthcare workers, thank you. And for others, there's really no reason to wait a minute longer before getting a vaccine. We've seen the difference. 90% of these deaths could have been prevented with vaccine. I'd also like to express my thanks and the thanks of the healthcare teams for the community response, thanks to the churches and other organizations and groups who have brought food and treats to our healthcare workers at the end of their shift. It seems like a small thing, but I can tell you that it has made a visible difference to our teams and a boost in their morale as they have been working hard to take care of our community and have seen so much suffering and death. It's important to say thank you to them. So, Jeff, back to you.
Thank you, Dr. Hudson. Now we'll go to Dr. Karen Landers from the Alabama Department of Public Health.
Jeff, thank you very much. Dr. Hudson, thank you as well. Prior to my presentation today from the Alabama Department of Public Health and the Madison County Health Department, I would like to recognize that we do have a new physician on board with the Alabama Department of Public Health. He's here in the audience, Dr. Wes Stubblefield, whom I have known for a long time. He is a primary care pediatrician as well as holding an MPH from the University of Alabama School of Public Health. So again, we are very excited to have Dr. Stubblefield here as an additional asset for the support of our public health efforts during COVID and beyond. So thank you for being here, Dr. Stubblefield. I would like to build upon what Dr. Hudson said today. She and I talked a little bit before the presentation that she did, and really the excellent way that she spoke to the data, but also brought the data to the point of remembering that every point of data is a person, and she lives that every day with her team there in the hospitals, treating patients in the intensive care units on the floor, as well as persons that unfortunately, again, leave our hospital not in a way that we want them to leave. So I just want to remind the general public that data is what guides us in our response in this pandemic. But every piece of data represents a person who has had COVID disease or has COVID disease or who has passed away from COVID disease. Now, when we speak of cases, we're really talking again about individual persons who either have tested positive through nucleic acid amplification test or a positive antigen test. Again, we have, of course, the cases that are confirmed and probable. They're managed the same way. The numbers of cases in a community help us to establish the level of community transmission, as does the percent positivity. Again, the percent positive is the number of positive tests that have been performed in that community compared to the total number of tests performed in that community. And that's how we establish, again, the percent positive. And a couple of the parameters that really help us understand whether we have high, substantial, moderate, or low transmission, again, are the cases on the percent positive. So, for example, if you look at our map now, you look at statewide and you look at Madison County, you can see we are in high transmission. And what does that mean? That means that we have 100 or more persons for 100,000 population. So again, 100 or more persons per 100,000 population that have COVID. And our percent positive, for example, in Madison County over the last 7 days is about 16.7%, which means that of the many places that do test in Madison County, 16.7% of those total tests are positive. So that puts us in high transmission. So what does that really mean? Again, how do we bring that down to practical recommendations for people to be able to follow so that they can hopefully reduce their risk of getting COVID, hopefully not show up in Dr. Hudson's facility or other facilities, do not have severe cases of COVID, and do not die of COVID. So again, when we're looking at high transmission, that really translates to our having strong mitigation. And strong mitigation means that we follow our preventive measures such as mask, hand washing, social distancing, certainly masking indoors and trying to keep our distance indoors. And again, outside, if we're very close together with people, we need to mask. But another measure that we must continue to emphasize is vaccination. Now, it's good to see the rates in Madison County. They're actually some of the highest we have in the state of Alabama. If you look across the state, we probably got about 41% persons who are vaccinated, and over 50% of the total population. I mean, I think if we look at that, we've really got that much, which is much better than we were. But that's not where we need to be. There are still persons that are eligible, persons 12 years of age and above, who are eligible for vaccine, and we need to get persons vaccinated in order to cocoon and protect those who have less optimal response to vaccine, and also, again, those under 12 years of age who are not currently eligible for vaccine, although we know that Pfizer is going to submit for the EUA. So my particular concerns as we drill this data down to persons and to practical information is to remind everyone that at the moment we are seeing, I would call it a decline or a plateau in overall numbers of cases. But when we have 5,000 or 6,000 cases a day, and now we're down to 3,000, I mean, on the surface, that looks pretty good. That means we've got maybe half as many people that have COVID as had COVID, but 3,000, that's a lot. That is a lot. And again, percent positivity overall statewide, we're a little over 15%. That is a lot. So even though we are enjoying this plateau and hospitals now have 4 extra ICU beds, there is no reason for us to abandon the data and abandon the mitigation that data indicates that we need to follow. We must be vigilant in our efforts to get this virus under control. And as Dr. Hudson so eloquently stated about the Delta variant and the transmission and the overall risk in the community, again, the more opportunities that we give the virus to infect people, the virus will find a way. It will find a way to sustain itself. And the virus has particularly found a population in terms of the pediatric cases. We now have in Alabama over 25% of our cases in the 0 to 17 age group. And that is way above, that is probably over half of what we had last year at this time. So 25% of our cases are pediatric cases. And to drill that further down, we're talking about obviously 0 to 17. Those are our children. Dr. Stubblefield's a pediatrician, I'm a pediatrician, and we have a particular interest in keeping this population healthy and safe and in school. And while Dr. Hudson was speaking to the issue of hospitalizations overall, I want to remind everyone that not only is our pediatric number of cases holding steady in Alabama, but our hospitalizations of children in Alabama are holding steady as well. And for example, if you look over the last 7 days, we're probably close to 40 to 50 kids at any given time in the hospital, if you're looking at an average, and somewhere around 6 to 8 kids on ventilators. And we have to remind that those individuals who either have had COVID and we know they had COVID, or persons who have asymptomatic COVID in that age group are at risk for multisystem inflammatory syndrome of childhood. So again, all of our mitigation needs to continue to be exercised to protect our entire population, but particularly now we need to focus on the children. And we have measures to protect the children by mitigation, but we also have measures to protect the children by vaccinating those 12 and above. And I really cannot speak more strongly to the issue of we as adults doing our part and continuing to take every effort to protect, again, our future, and that is our children. In closing, I would just like to remind everyone that the Alabama Department of Public Health continues to follow the science on this subject and continues daily to increase our knowledge base by participating in panels with other scientists, reading articles related to this. And again, Dr. Hudson knows you can't read everything that's out there. That's the peer-based articles. There's just no way. There's so much out there. But we do all we can to continue to follow this. We follow the guidance of expert bodies, not only the CDC, but also the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, and many other specialty groups who are involved with specific populations. And we take all of this information, this scientific information, and bring it together to promulgate our guidelines and formulate our plans to do all we can to protect the citizens of Alabama. So I would just like to close by saying to everyone, please continue to join us in our efforts to protect our entire state and return us to a level of normalcy that we absolutely need in order to move our state forward. Jeff, thank you very much.
Thank you, Dr. Landers. And thank you for watching today. Our next scheduled briefing is next Wednesday, September 29th. Would like to make a note, due to a scheduling conflict, the briefing will be at 1 p.m. rather than noon. Again, the briefing will be at 1 p.m. Until then, critical updates.
Special
will be
coverage
posted to
here
the City
from
of
Madison
Huntsville.
County as health leaders update us on the current mitigation efforts and the current data for COVID in our community. We hear from them telling us that cases overall and hospitalizations have plateaued and maybe even started to decline a little bit, but we are, quote, not out of the woods yet, and there is no way to, quote, abandon those mitigation efforts. That includes the masking, social distancing, and good hygiene practices. We want to get you back to your regularly scheduled programming. We will have a complete update and continued coverage for you coming up at 4 o'clock on our evening broadcast. But for now, I'm Matt Kroschel in our Way TV stations. Now back to your regular scheduled program.